where I spent 6 weeks on an arthroscopy fellowship. And secondly, to give me the chance to stand here and share this dais with such esteemed speakers so that I can share my experience with you. Now I'm going to start off with this picture. I'm sure you might all be wondering, what does a picture of an empty corridor have to do with anything? But I request you to be patient. Hopefully this will start to make some sense as we move on. Now this happens to be one of the longest hospital corridors in Europe. It's said to be almost 1 kilometer long. And if you stand at one end of the corridor, the other end is not visible. It's that far off in the distance. Now this in a lot of ways reminds me of the state of mind of young orthopedic surgeons like myself, and I'm sure I can speak for a lot of my colleagues in attendance here, especially the ones who have chosen arthroscopy as a career path. We know there's a long learning curve. We know there are a lot of uncertainties. And most importantly, just like this corridor, in a lot of cases, we are not able to see the end. Now, whenever you tread through an uncertain path, the most important thing that you need is a good mentor. And I found that in Mr. Angus Robertson, who was my mentor and fellowship guide. Now, apart from being an extremely skilled surgeon, experienced surgeon, he was also a very vibrant personality. And he was the reason that my fellowship experience was amazing. So firstly, what Mr. Angus Robertson did was he helped me settle in, get my footing, which is very important for when you travel to a new place. He took the time to speak to me. He had a small chat with me, and he understood what are my goals and expectations from this fellowship. And most importantly, he formulated a plan for me. This is something I didn't have in mind, but because of his advice, he was able to tell me, because see, the fellowship was a short one. It was for 6 weeks. So he was able to guide me and tell me to have focused goals. And he shared his knowledge not only about arthroscopy and orthopedics, but also about many other things. And most importantly, he would encourage me to travel and explore during the weekends. So in UK, they had a 5-day work week, so you're mostly free during the weekends. So these are the two surgeons that really shaped my experience while I was in UK. Firstly, my guide, Mr. Angus Robertson, and secondly, Mr. Tim Matthews, whom I shadowed a lot during my time there. So I'm basically interested in shoulder surgery, and Dr. Tim Matthews did a lot of shoulder replacements. So I should literally shadow him, and all the cases of shoulder replacement that he had during my time there, I was there in every single case. Now, what did a typical week look like while I was there? So firstly, we had our clinic days every Monday, which is like our routine OPDs. We had one theater day a week, which was on alternate Tuesdays and Wednesdays, and a theater day every Thursday, which was at Spire Hospital. That is where Dr. Robertson used to practice privately. And the rest of the days, you're free to accompany any other consultants in the department. So this was the time I used to focus on my specific areas that I wanted to gain experience on. And the good news is there are no commitments for calls or ward work. Now, why does going to UK make so much sense for us Indians? Firstly, the transition is easy. Being an English-speaking country, there's no language barrier. It's a familiar system, and I say familiar without ever having worked there, is because I'm sure a lot of our bosses and a lot of our consultants in India have been trained in UK and have worked in UK. And that before going to UK, I was at Hinduja Hospital in Mumbai, and almost 90% of my consultants were UK trained. So having heard from them and through their experiences, it almost seemed like I know how the system works and what to expect. Secondly, it's very culturally accepting. UK as a country is absolutely multicultural. And in a way, they kind of, since this fellowship has been going on since almost a decade now, they are kind of aware of our training system. So when you tell them that you're 3 years or 4 years post-PG, they kind of have an idea to gauge what is your experience like and what your skill set would be. So that's very helpful, especially when you go for a short-term fellowship, because you want to break the ice really soon, get comfortable, and then start absorbing everything that's happening there. And the other advantage of working in the NHS is, so the NHS is a very watertight, protocol-driven system, which is not necessarily what we are used to. So having that experience broadens your horizon in a great way. The best of both worlds, as I said, I got to see work in the public sector, that is the NHS, and also the private practice in UK. Now, when you tread on this path, on any path rather, there are always roadblocks. I had my share of a few roadblocks, not something to complain about, but in the initial days when I went there was some issue with my documentation. My joining date was delayed by a few days. I had some travel plans early on, which I had made for the first couple of weekends, but they had to be cancelled because there was a weather situation. So it was a bit of a downer, but my message really to the prospective fellows who will be traveling is, not everything is going to go according to plan. You might have some expectations, things might work differently, but that's part of how things work. So you got to brush yourself, get up, and make the most of your time there. Now again, when you travel overseas, it's a great time to see how orthopedics works in different parts of the world. But you should also remember this is also a time to explore the culture, go out, travel, because these are things that we sometimes tend to neglect. But trust me, in UK, all your colleagues, all your seniors will push you to do this. So I did my share of exploring. I'm a major football fan, an Arsenal fan to be precise. And true to my nature, I didn't make my bookings in time. So I didn't manage to get tickets for an Arsenal home game. So what I had to do was go undercover as a Leicester City fan just to watch an Arsenal game. But I had to do that since I was in UK. Secondly, I took some time on to catch up with old friends. A lot of my school friends are in UK, so I found some time to meet them. If you're someone who's into outdoor activities, Wales per se is absolutely phenomenal. There are a lot of trekking trails, a lot of biking trails there. I didn't get to do a lot of this, considering the fact that I was there during the winter. But if you're there during the summer months, this is absolutely something that you should not miss. Now, what did I gather from my experience in UK during my fellowship? Firstly, I sharpened my surgical skills, and I did that in specific target areas. To give you a certain example, I was always trained to do shoulder scopy in the lateral position, and ever since I've started, I've been doing that. And I wanted to try doing it in beach chair. I tried it a couple of times, but I struggled. So when I told this to Mr. Robertson, he took it as a personal challenge. And every time we were doing a shoulder scopy case, he would give me small tips of how I could make that transition in the beach chair. And he's given me a target. He's given me 1 year. So I have time up till next Feb. I have to call him back and tell him that now I'm a beach chair person. Another thing that it did is it broadened my perspectives on patient care. The way things work in the NHS is very different from the way we function here. So having that experience is something that definitely helps you in a private practice. And most importantly, I realized the importance of developing systems which are customized to our practice. I know that a lot of times we work in an unorganized sector, so to say. But there's still space to create some kind of a structure that works for you. It might be different for different individuals based on where you work and what type of setup you work in, but that really helps. Now back to the picture where we started. Now I'll fast forward back right to the last day of our fellowship. We had some time between our cases. It was my last day at the hospital. So Mr. Robertson offered that we should go and grab some coffee. So we went to the nearest coffee machine. It was broken down, so we had to walk all the way to the other end of the hospital to get some coffee. And while we were walking, we started chatting, and he started asking me whether I was satisfied with my stay here and what I picked up. And we were kind of, in a way, recapping all our experiences, all the interesting cases that we'd seen. And he was suggesting me how I should document all of that and, have a plan to incorporate that into my practice. And then we got to the cafeteria. We were standing in the queue to get our coffees. And he turned back to me and he said, by the way, do you know, Lester, we just walked along the longest corridor in Europe, which is almost a kilometer long. So I said, yeah, really, a kilometer? That didn't seem like a kilometer. It seemed quite fast, the walk. So it was then when I realized that if you have the right guidance, if you stay consistent and committed, and most importantly, if you learn to enjoy the process, you might not reach a goal immediately, but you'll definitely cover a lot of ground, which is a good start to have. Thank you.
And I will request Dr. Manivannan to give a talk on his Vail Fellowship.
Good evening, everyone. This is just a small talk about my experience in Vail Hospital. The Arthroscopy Fellowship at Vail Hospital is accredited by ISOCOS, and it is a high-volume center where you can see variety of cases and various exposures. So obviously, it's a great place to learn, and it allows you to build up your own confidence level. And how to get into this training program? Our boss has streamlined the program for the entry process. You have to crack the exams, interview, and previous arthroscopy exposures, publications, previous cadaver lab exposure also adds up to your scores. And obviously there is a waiting time of about 6 months, maybe 12 months or even longer. So if you are keen in entering into this program, start applying at the earliest. And when is the right time to get into fellowships? There is no perfect timing for this question. It's always subjective, and from my point of view, it's a time frame of like 2 to 3 years after your masters would be a great time, because before entering into any orthopedic specialties, gain adequate experiences in trauma surgeries. And why fellowships? There are always two sides of a coin. So as for fellowships, when you look at from the trainee's perspective, the intent of a student is to acquire knowledge, to acquire new skill sets. You get trained under an expertise. You can establish lifelong association with your mentor. You can get in touch with the experts of their specialty. Obviously, it will add a value to your CV. You will mature as a surgeon. More importantly, your resilience builds as a surgeon, which means the ability to bounce back from your failures. Misfortunes do happen in medical specialties, and when you get trained or when you work with senior surgeons, you will be exposed to avoid complications, how to face those complications, and how to get out of those mess. More importantly, you should stay calm and humble at your highs, and you should remain normal at your lows as well. And with respect to practice, definitely it will have an impact in your practice. Honestly speaking, I'm not into years and years of practice. I'm just budding. I'm away from KNSR for the last 1.5 years. And when I take a look at my approach to the patient, the way I handle my soft tissues and the way I close my wound has certainly changed a lot after this program. And when you look at from the trainer's perspective, the intent of my boss is very clear. He loves training younger generation, and he is very keen to take arthroscopy practice to the nook and corner, and it creates a bridge between generations of surgeon, and he loves to pass on information to the younger generation. And you will be obviously a part of their working force, and he is the one who is putting Madurai on the global maps of arthroscopy. And when you look at life at Vail Hospital, it will be very busy. Sometimes your day starts at 4 or 5 in the morning. You will be working till 11 or 12, and you will be roaming in and around the city, or sometimes outside the city as well. But the most important and the beautiful thing is boss is always cool. You will not have any stress or tension while working, so it will be a very conducive environment for working and learning. And the learning in Vail Hospital will be more of learning by seeing and doing. You will get to do a lot of surgical assisting work. You will get to do supervised execution of surgical steps. When you do a step with ease and perfection, you will be rewarded and you will be given the next step. When you find difficulty in doing a step, boss makes sure that his words keep echoing in your cognitive framework, and he will get it. He will definitely make you do it in a prompt way. You are supposed to record your work and maintain your logbook throughout your period. And with respect to academics, there will not be any regular blackboard teachings or PowerPoint presentations. But during the course of your fellowship, you will have plenty of time. Whatever you ask for A to Z, boss will pull up a paper and explain you anything, be it a surgical condition or surgical procedures. And these are all some of the topics which I discussed with him during my tenure. And he helps you to plan for surgical procedures, be it be it any rotator cuff repair or band cuts revision ACLs or meniscus repair, and it will definitely impart in your career and practice as well. And whatever kind of work you do, it will be definitely rewarded. Your work might get published in some local medical journals or in some conference journals. And if you are smart enough, you can pull your work to the international publications as well. So to all the aspiring surgeons here, wherever you go or whichever fellowship you enter, so go with an empty mind. Be ready to unlearn a lot. You have to learn and relearn many things with precision. So always be hungry and eager to learn. Work hard. Have the commitment and intention have the intent and attitude of committing yourself fully to the program. So prepare yourself physically and mentally, because the best outcome in life and surgery will always come with preparation, patience and persistence. And finally, this is a slide to express my gratitude to my arthroscopy gurus, Dr. K. N. Subramanian sir and Dr. Harish Chandran. In Japanese, there is a word called ikigai, which means a purpose of life or a reason for being. One must understand that what he loves, what he is good at, and what the world needs and what can be paid for you. So you have to stand at the confluence of these circles. With the right mentors, you can strike the balance so that you can yield the best out of you. Thank you.
Thank you, Dr. Manivannan. We have the last talk of the fellowship program and how it works by Dr. K. N. Subramanian.
Good afternoon, all. I think at least 100 people are here right now, and more than 300 to 400 were there yesterday. Everybody came for improving their knowledge in arthroscopy in some way. Everybody is at different level. Some are at a basic level, some are at a higher advanced level. But at every stage they want to learn something, and that is the reason you are sitting here. Okay. And I see still there is a huge demand gap for arthroscopy. As I mentioned some data here, as per this data, still India needs a lot of arthroscopic surgeons, and awareness among public is still not there. That has to increase. For that we need more people of you who are getting trained in arthroscopy, so that ultimate benefit will go to the public who are really in need of it. When you want to learn and also to prosper in career, my first thing I say is develop a passion. When you have a passion and you are doing your work, you don't get stressed at all. And I think Mani clearly told, I work here very cool, he said. My boss is always cool. But that's what I mean. What I try to say is, if you have a passion to work, then what you are secreting in your body is endorphin, not adrenaline. When you are having stress, automatically then what you are in adrenaline cortisol level, because then it makes your body a stress and you are in a real temperate level. So always try to develop a passion for something what you do. Then the time is not important. If you have a passion to do it very comfortably and do it with full satisfaction, the patient outcome will also be better. So that's what I want everyone to have, that passion to do your work. What should be the mindset of aspiring arthroscopic surgeon is, first of all, they should be very clear in basics of orthopedic, and they should know the importance of academic and clinical excellence. Because just knowing something and practicing is not good. You have to keep on updating and doing and do what is the best practice for everyone. So that is important. And discipline, punctuality is a basic criteria for everyone. As I told you, sometimes you have to come at 4 a.m., sometimes you have to be the discipline and punctuality should be there. Then only your learning will become much better, and you will also prosper in your career always. Yeah? To think of mastering in such specialty. So I always tell to my postgraduates and juniors, try to do something different from what others are doing. Then you will definitely edge out. So see, your mind will know that something you are good at it and try to make master out of it. Then you will automatically shine. And whenever you have failures, don't downfall. You think it is actually a next step to think and build your career. That's what I always thought like that, and I want everyone to think like this so that failures are always a stepstone for success. Arthroscopy actually has got a very steep learning curve. First thing, you need to know about what you are using, what equipments you are using very well. And it's a different type of skill because we are used to handle bigger instruments with because chisels and osteotomes and all, we are used to handle, but it is a delicate skill. And this different type of skill, you have to carry on by mind training. So the basic thing is that you need triangulation. For building the triangulation, we have to have that, we give auto box and ask the trainees to get trained in that for 1 or 2 months so that they get the triangulation skill. I think Arvind actually is one of my fellow who has developed his own auto box. And it's called Madurai box. He named it as Madurai box, whereby he has a small box whereby you can put a scope and try to take some objects from it so that he develops your triangulation skill. If you develop the triangulation skill, it is common for whether it is a knee or shoulder or whatever arthroscopy, even for laparoscopy also. That triangulation skill is the only thing that you need to develop. If you master in that, then you can do anything in the arthroscopy. All are based on that only. So for my fellows, what I do is when in the first 1 or 2 months, I ask them to just do this one only, just to do that, taking the fat pad out in the anterior, anterolateral, anteromedial portals, and then go to the ACL footprint clearance. I don't ask them to go to the meniscus at all first. The diagonal, because to get the triangular skill is very important. That can be acquired only in these particular steps. So this is the way we train them. First 1 month they will. In the second month they start doing ACL in our most of our fellows. Second month they do ACL. Around 4th month time they are coming to the shoulder at all. In 6 months time they are almost complete with well versed in ACL, doing almost 20-25 K they have done, and also doing some shoulder case also. So remember this concept. It's a well studied concept how your mind works. And to go to this stage of automation, we are starting from cognition where you are trying to assimilate something in the brain and then putting everything together and then coming to autonomous stage. This almost actually takes a lot of time. So you are going from goal, activity and performance. This is actually well published literature about it. How a person learns some new skill. So unless you keep on thinking about it, it's like driving only. Car driving, you can't learn it in one day. But if you keep on thinking, you do it. At one point you do it like a reflex action you are doing. Same thing you are doing in the arthroscopy also. Where you try to correlate everything in the mind and then slowly integrate it and then you put it in the performance. I tell this to those who are not getting the triangulation skill. I ask them to have a platter of food and see the mirror and watching the mirror and you have to eat it. In right hand and left hand, if you do alternately, suddenly you will see that your triangulation skill suddenly becomes improved. So for those, when a fellow comes, first 2-3 weeks he will really struggle to hold the scope. He can't even hold the scope at one place, it will wobble around. That time I tell them to do this for about few weeks, then automatically it will come. You start getting the triangulation skill easily. So this is a well published literature. If you learn a new task, it needs at least 12 repetitions to get some grip on the skill. So you will always feel like, I have seen fellows like, sir, this is not for me, sir, I will go. Telling like that also in first 2-3 weeks time. He will try to do the arthroscopy, he said, I am not getting it, sir, I will go like that. So that's why I tell all these things to them. Perseverance is very important. Don't give up. It will come. If I am able to do a skill, I am sure you can also do it. I was also at the same stage some many years ago. When I started, I was also struggling. But I am able to do it now means the same thing you can also do it. There is no way you cannot do it and all. Okay. So, and I have seen this plateau where as the time goes on, until one stage they will be really struggling, suddenly you feel like you are very confident in doing these things. That is where you have got the triangulation skill. This is the typical learning curve in arthroscopy. They will have a plateau at one point and suddenly they will be increasing and then they will keep on progressing slowly. So this for you to get that plateau, it takes about 2 to 3 months. After that you will start feeling like you want to do more and more. They will have like a hungry. I want to do more case. So that passion will start coming only after that 3 months. So you have to be patient, learning for first 2 to 3 months. At that time only then you will get that, you are learning well now and all. Okay. So as I told you earlier, cognitive stage, associate, autonomous stage. Okay. To get to that proficiency, it almost takes about 5 years. So beginners who are finishing their fellowship, they are only in the second stage only. To go to that stage, you have to keep on practicing what you are doing. So it takes a few years for getting that to go to the autonomous stage, and then you start building your skills more and more. So how to get trainees? Knowledge, cadaveric workshop, conferences, all are available. Not only me, there are so many fellowships are available in India now. I think about 10 years back there were only few fellowships. Now there are plenty of fellowships. And there are plenty of very good trainers where you have to apply for everywhere and you can get it. There are short-term fellowships available. But remember, you cannot learn arthroscopy in just 2-3 weeks time and all. It is not possible. You have to have a dedicated mindset for at least 4 to 6 months. Then only you can have a grip of skill. I am telling for the beginners. Those who already know it, they can top up the skills by watch. If you are going for an observership or a UK fellowship and all, you should have some good knowledge of it and you should having some basic experience. Only then you can go on top of your skill. Because in 6 weeks time, you can see so many things. You will look nice, but when you have to go and practice, you cannot do it. So you have to have some good long-term fellowship only that will work for you for pursuing your arthroscopy career. So this is the end point for our fellowship, but this is a starting point for you. Okay, we give a certificate and they become happy, but that is where you are actually turning point in the life. But you are starting career, you are starting the career, and you start building up slowly and slowly. And continuous progress and career advancement will only happen if you keep on doing the things repeatedly. So don't have a mindset of just I will do ACL, I am happy. You have to keep doing more and more. I have seen many fellows who come, once they do ACL, sir, I am okay, sir. But you have to learn more. Then only you can keep progressing the career. Okay, it's like running, that's why I told. It's like running on treadmill. If you stop running, then you feel like your fitness is lost. Like that, you have to keep on doing your skill, then only you will feel like you'll be able to do more and more. This already I told you yesterday itself, never think there is a competition. There is no competition when you have competence. Many fellows who come from other areas, they say, sir, already there are 2 surgeons there, sir, what will I do? Only 2 surgeons there, you have more room there. When there is competition, there is no competition at all, so don't worry about competition at all. Okay? This is what happy moment for me, when my fellow writes, sir, I have done 1,000 arthroscopy cases. It's over a period of 3 years' time. My fellow is writing to me in, August 20, he did my fellowship in 2018, and he's saying that, sir, I have done 1,000 arthroscopies in 3 years' time. This is a real happiness and pleasure for me when a fellow writes to me like this. So this is the common saying for everyone. This is a saying from UK. Whenever you entering into career training there, they say that you have to have the KSA. KSA means knowledge, skill and attitude. Knowledge and skill are something that you will acquire by some means. Whether you get it from me or by reading or maybe 3 years time you get trained. But attitude is important, which is going to build up your career on a long term. So develop the right attitude, which is basically how you get along with others, how you respect your other peoples, and how you are seeing the whole career as. If you have the right attitude, your development is not going to be, there is no border for your development. You will go high sky high. That's what is the ultimate destination for you. Have a right attitude. That's where you grow. So that's the most important. That's what they taught us in UK also. When you're doing our training program, they say we should have the right attitude for the long-standing, continuous, sustained growth. That's what you want, not a transient growth. So in order to that, be academically vibrant always. Try to become, if you are not member, because these are all the bodies which are trying to help you to keep you in the pathway of your academic development, and also will tell you you develop contacts, keeps updating what is going on in around the globe, so that you do the best practice for them. So become member for IAS and also ISACOS also. Both are, IAS is easy to do, ISACOS is a little expensive one, but at least you at some point in your career you have to become member for that. Okay. So to conclude, become a good orthopedic surgeon. Choose a subspecialty that you will be passionate about it. If you enjoy doing your work, you will always excel in career. So do enjoyment when you are doing work. Okay, that is very important. Stay focused and strive for better every day. Never there is a competition. Try to become a good teacher by, if I tell all my trainees, be very soft and good to your trainees and teach them, so that whatever you learn should not go with you only, should go to others also. That is very important. You share your knowledge and skill wherever possible. Do no harm, offer always best to the patient. That is a mindset you are working on all. If you think that, then you will definitely build up in your career. So my sincere thanks. These are all my trainers. Angus Robertson is also one of them who was in UK. And these are all my trainees who have been so far. I think maybe I would have left few names because I have lost the list of it. There are, I think, 65 people out there now. So my best wishes for everyone to be an extremely good arthroscopic surgeon. Thank you very much.
Thank you, sir. Do any of the aspiring fellows want to ask any questions?
I just suddenly Dr. Denny Lee has offered. Sorry, am I okay to say? Okay, he said that he will take our people to have fellowship with him or observership with him for a short period. Sir, yeah. So, which is happy news for all of you. I want to tell before you leave. That's why.
Thank you, Kian. So what we were thinking is it's like a capstone to your fellowship. So you've learned all the basics here with Kian or with other fellowships, and then the last bit of 1 month or so, you come and join us. A little bit like going to UK, but we don't have that nice hiking trails. But as you know, Singapore is very near. The flights are easy, culturally very friendly. We all speak English as well. But we are a large team, so we have shoulder, foot and ankle, knee scopes. So we just pack you in with a lot of things. Sorry, I don't think I can give you 2 days free, but we'll just pack you in with all the exposure. And like what Kian said, to be mindful, to think carefully, to strategize your career. It's really a capstone to your fellowship. So Kian and I are working on this, and we hope to welcome all of you as part of our journey. It's something we all are passionate to share our knowledge. It will just flow together. So thank you very much. Thank you.
May I request, Jenny, 1 minute, yeah? May I request Dr. Samir Sheikh to come onto the stage to honor Dr. Denny Lee.
I now request Dr. Jyoti Prashant, Dr. Prajwal, and Dr. Tirivim to moderate the last live surgeries. Can we have the case presentation for this?
Hello. Rotator cuff tear, surgeon Ayyappan Nair. Case history, 52-year-old female patient, had no history of injury, complaints of pain and difficulty in lifting the right shoulder for the past 4 months. Clinical examination, right shoulder, no swelling, difficulty in abduction, no muscle wasting, no sensory motor loss. Clinical test, Hawkins test positive, Jobs test positive, drop arm test positive, internal rotation, able to do up to L5 vertebra. X-ray, MRI, tendinosis with partial thickness footprint tear of supraspinatus and infraspinatus with delamination of fibers, superior labral tear, slap injury with paralabial cyst, acromioclavicular joint shows degeneration with capsular hypertrophy, subacromial subcoracoid, subdeltoid bursitis C. Over to sir.
Hi, this is Ayyappan. Okay, who is there moderating? Ayyappan, sir?
This is Jyoti Prashant.
Hello.
Hello.
Check,
Ayyappan.
check.
I appoint Dr. Jyoti Prashant.
Your mic on, sir. Hello, check, check, check.
Yeah,
check,
we
check,
can
check.
hear you.
Who is speaking?
Dr. Jyoti Prashant is there, Dr. Prajwal and Dr. Tirviam is there.
They can't hear us. I think.
Dr. Ayyappan, can you hear us?
Yeah, who is moderating? Is there somebody?
Dr. Jyoti Prashant is moderating, Dr. Tirviam and Dr. Prajwal Ganesh.
Hello.
I don't know if anybody is listening to us at all.
Yeah, we can hear you very clearly. It's just that the audio is not
check.
reaching you.
We can hear you. Hello.
Hello. Is there somebody there?
Yeah, we're here.
Is there somebody there?
Yeah, we're all here.